nous donnons la bienvenue. Welcome to this webinar. This is the learning in multi-country, multi-language for the care of high-quality care for sick and small newborn. The newborn toolkit is available in 11 languages, and it's in English and in French for the community of practice. Next slide, please. So this series of seminars for the toolkit is organized with 10 elements which are essential for the newborn who are sick. Still today, we talk about this to accelerate survival for newborn to reach the SDG of 3.2. You can join our community of practice and access information and news and share tools and ideas. Next slide, please. Currently, right now, I'm going to introduce our moderator for today, Dr. Frank. Is a pediatrician who specializes in nutrition. He has experience in management for newborn health and child and teenage health and project training and research. He has experience in LMIC, excuse me, and worked for 10 years for international nonprofit organizations. He's currently technical advisors in Africa and our non-profit organization which supports in Central African Republic. Ever since 1921, he is associated with the Neonatology Association. Next slide, please. So Frank will be our moderator today for this webinar. Thank you. Next slide, please. To start with, I will speak regarding the toolkit for newborn. My name is Lauren Allison. I am the manager of the toolbox for newborn and the community of practice in France. I am a nurse for newborn, sick and small newborn care. Where are we currently in 2024 is marks 4 years to remaining to achieve the SDGs, and we want to have some 2022 data show that more than 64 countries are not on the right track to achieve those goals. And there is a lot of newborn death, which is concentrated in Southwest Africa and other regions. We need to accelerate progress to and better the situation and improve it, but how should we do it? And we also need to have funding, leadership, clinicians, a data system, efficient orientation system, and participation of healers and care workers, along with a system of referral system. This is the goal of our newborn care kit, organized to have an online platform and resources, including tools and lectures for the people in charge of implementation of the care for newborn, sick and small newborn. This was created in conjunction with NEST 360 and UNICEF. Next slide. the community of the newborn care developed in 2021. And during that year, we were able to have 55,000 new unique users per year coming from more than 170 countries and 3,000, over 3,000 participants to each webinar. Main users per country are India, Kenya, Nigeria, and for among the French-speaking users, we have people from Senegal, RDC, and Burundi, or DRC, and Burundi. The platform of the newborn kit features tools and lectures in 15 different languages with technical content available in French and organized by the UNICEF and OMS stand. It includes the main lines of the UN, and it gives you material for training, list of medical control plans, etc. Over 450 documents, key research documents for newborn care. We also have some updates for 2025. We can't wait to launch new action processes and in order to be able to launch new ways of helping newborn care and also have a toolkit to implement the care for SNNC. And if the so why the management of pain, why do newborn feel pain? What are the proofs and evidence for prevention and of the taking care of pain? Who is a part of this team, and how can I implement and improve that which we do for neonatal pain in my own unit? 2025, we organized a series of webinar focusing on 10 components of the change of health systems for SSNCs. If you wish to participate in the webinars, please contact us. Here are the themes we're focusing on: financing and human resources and etc. Partnerships and collaborations are an essential component in the health system, and to implement the toolkit for newborn, we need to identify what we can improve in the practice of culture in my unit. How can I develop a file of national investment to improve the situation and increase financing for the health of newborn and mother's health? These slides and strategies and documents are available from the Ministry of Health, and key documents and guiding lights. The toolkit is available, and over 200 resources are available on the site of the toolkit for newborn care in French. What has been done in other contexts, and how can I derive learning from it? There is also a multitude of organizations in the field of SSNC. On this slide, you can see several associations on the international level, NGOs and others. And we have also association to collaborate on the national and international level, and the establishment of partnerships. I encourage you to take a picture of this line and to We'll have some of those organizations present here on this webinar. They will speak in a few minutes. Next slide. As a conclusion, I would like to give you an example of a partnership, a collaboration between the Newborn Toolkit and the Neonatal African Association and the Chiesi Foundation. And there is also the integration of um, caretakers at all levels of healthcare. I am very happy that the winners of the French competition is Israel. And the reward this year is £500 publication in the Neonatology African Journal, invited to the Global Neonatal Podcast of the Incubator Network and conference participation to the next conference. Here is the winner with a few words from Israel, Yamu Jaime, thank you so much, Israel. I think you will be there for the post-webinar conversation. Please keep reserve your questions till the end of the seminar. Next, hello everybody. My name is Israel. I am a nurse in Burundi and in the neonatology service ever since September 2015. I take care of a physiological visit and checkup of a newborn prior to a release. And I also work on emergency surgery. I decided to participate to the competition to share with others simple ideas, but likely to improve premature and small and sick newborn care health. And the theme of my essay is the education for changement. And our hospital, a lot of things were done put to put the family at the center of the newborn life, but it's still not sufficient. Lots of things remain to be done to focus on the parents as being central to the care of their newborn and not consider them as spectators. A family can have the best neonatology in the world, but without the consciousness of being able to choose the care for their newborn and or nor having the tools appropriate to do so, the efforts of the family will still be without any impact nor wait for the health of their newborn. I take time to, in my ward, to talk with the newborn parents and let them know about the various aspects of the life of their newborn child. Thank you. Please remain here. We will share a publication in the African Neonatology Journal and with Israel in using the newborn toolkit to remain abreast of partnership opportunities. Next slide. I believe, I don't know if Frank is here. I can introduce him briefly. And we'll go to Faust and go back to Frank little later on. Toby, can we go to Faust, please? Thank you so much. Today, we have Faust Uwingabir. She is a specialized nurse in neonatology in clinics and for training nurse and head of the neonatology nurse of her country to ensure quality care. Her vision is to save newborn life thanks to training and mentoring. And she is the winner of the Coin Prize for uh, neonatal care in 2019 for her contribution to the advancing of nursing care on the international and national level. She has a lot of in experience, and she launched that program as a neonatal nurse based on skills to implement on the national level. Here is Faust. Faust, you have the floor. Thanks so much, Lauren. And I speak in the name of the COIN National Nursing Institution who has with a partnership with Nest 360 to uh, accelerate the realization and of the SDGs and to save newborn life. On this slide, you can see photos with teams, multidisciplinary teams, aiming to uh, join efforts to make a difference in the care of the SSNC, the small and sick newborn care, especially in Africa, where neonatal mortality remains very with COIN, we're always trying to drop barriers between doctors and nurses so that work is complementary and solidification of communication canals and channels of clear and open communication to clarify also via regular meetings or exchange the expectations, roles, and responsibilities. Here you have the COIN president with the representative of newborn support in Zambia, a pediatrician and a neonatal nurse. We are cutting a cake to launch the neonatal nurse community. Next slide, please. We also value formation and training, rather, conjoined to participate together to training and to workshops and to have academic graduation. We valorize and value conjoint training and to get rid of misunderstandings and to have a practice in favor of small and sick children. On this photo, the first one, you see a nurse with experience in neonatology who is demonstrating with the proper care of a certain device. On the photo, you have a pediatrician who is sharing with the neonatology team and with students who are rotating in the neonatal ward. Next. We value collaborative projects to improve newborn care and collaborations between doctors and nurses in common projects. Here you have the COIN president, doctors and representative of the Zambia ward to working on newborn healthcare and implemented and created by nurses to put in place applicable care in the newborn care of the country. We also talk about specific skills for doctors and for nurses to value skills specific to each group, avoid territory conflicts, and talk about holistic care for nurses, which remain always with the children. and to also recognize the role of doctors in therapy and diagnostic based decisions, and recognize the role of nurses in practice, advanced practice, and the quality of continued care to be able to best take care of small children. On this picture, we are in the University of Rwanda of the first coin conference in Africa took place. On the photo, you have the vice chancellor of the university who gave its name to coin to the president and the conference participants. We also had the OMS representative who participated in the conference. Uh, we focused on the training of nurses and doctors, and also on the community of practice established when they are with the patient to ensure that care is complete and holistic, and no uh, separation between nurses and doctors. With coin, we also value the work that has been achieved, and we need to have a shared vision and to assist the newborn and its family, where each member is useful and essential. And we also value the institutions to support and value collaboration to facilitate discussion spaces and harmonization spaces and structures. On this slide, you see collaborative work where COINN, and members of the association and it continues to create this document as a model for healthcare, where we retain change to make sure we have the necessary resources and efficient and competent to accelerate newborn survival, but as well to make the difference between countries development developing countries and more advanced countries, and statistics in favor of small and sick newborn. Next, with COIN, we also value the patient, and our patient here is the newborn and his or her family, and the role that and the well-being of the child and his or her family is at the core of our efforts to prevent preventable mortality for small and sick newborn. We also always promote collaboration and is focused on this common goal. And all efforts are in favor of the newborn well-being, a small and sick newborn well-being. And for our agenda, we are preparing a conference which will take place in Zambia during the month of August 2025, and we will welcome nurses and anyone who has a role in the life of a newborn, sick and small newborn, whether it be nurses or social workers, family, to anyone who is contributing to reach the SDGs, the Sustainable Development Goals. Thank you. Right now, Frank has the floor. Thank you so much, Laurie. I hope that everybody can hear me. My name is Dr. Frank Hunjahwe. I am African Neonatal Association representative. In a few minutes, I will present our association. Thanks. The African Neonatal Association was launched in September 2021. Uh, of also almost 4 years ago. Its official headquarters is built in Kigali in Rwanda. The main vision from the start was to give a better start in life for the African newborn so that the rest of their life would not anymore be compromised. So our mission is to solidify capacities, and we are all linked in the newborn care, health newborn care, to solidify capacities, improve quality of care based on evidence, accessibility, and equity, and focus the care on the family. This association is currently in 37 of the 55 African countries. Our goal is to cover the entire continent. We have over 370 members, and we have an association which speaks three languages: French, English, and Portuguese. We don't want to leave anybody behind. We want everybody to be able to be involved in the care and effort towards improving newborn care. Work groups to reach the mission very quickly. We formed work groups, and you will see that the first line is the newborn thickness. And then we thought also of the care to be able to improve the SSNC, uh, thanks to a CPAP group and the kangaroo mother method, and which is still a major issue, and nutrition, of course, which is difficult on the continent when we know is that nutrition is iffy, and and it's all a very big challenge. So the work group is currently working actively at this issue, and to also to work on ultrasounds to improve the situation. Sound is lost. I don't see the next slide. Is there a technical issue? I don't see the next slide. It's the African Neonatal Network birth slide. I believe we lost Frank, unfortunately. Let's go on to the next presenter. Please change the slides if and which to give Frank a moment. Olivia, please. Oh, Livia. Livia Nagy Bonar is from the European Foundation and founded this foundation for the care of newborn infants. And this association has doctors and health professionals and political decision makers and NGOs to improve quality care. Livia is a nurse by formation and works with infants and children in cardiology and intensive care wards. She is the mother of a premature boy born during the second week of gestation, and she's a member of the European Foundation for the Care of Newborn Infants, and she's a member of the president's community of the Newborn Care Global Association. Was not able to be present here today, but she recorded a video regarding EFC and I. Hello, my name is Livia Bonar, and I will present for the FCNEI for the care of newborn. Unfortunately, I cannot be with you today live. So with this video, because I have a child who is having his 18th birthday. Unfortunately, with medical appointments, I'm unable to be present, but I can show you how FCNI works. So to talk about premature birth and turns about around the maternal and newborn care. Through awareness of campaigns and the digital communication and work on the international and national level and participation in scientific research. We participate with the researchers, but what we also do quantitative and qualitative research and work. We think it's very awareness and training of parents and health professional is very important, and we participate and co-organize conferences and events on the national and international level. AFCNI is here created in 2008 with a solid partnership with the various member states. So we have a very powerful network with over 100 associations of parents and patients throughout the world, 200 companies working on health and care, 10 partnerships for research, 60 countries, over 60 countries in the world. Our participation with several OMS work groups for maternal health to evaluate and assess maternal and perinatal health. And we recommend for make recommendation about sick and newborn care. We work with the European Parliament, the Commission, and the European Agency for Medicine and Medication. We work with our network with patients and parents, and we have also worked with governmental agencies. This is our group. We meet up every year, and all the adults who are born premature, representing newborn everywhere in the world. Our greatest success, and the reason why we're here today, is the Global Day of Prematurity, WPD, World Premature Day of November 17, and we have OMS, UNICEF, and other for over 40 global organizations joint effort to improve quality care for the newborn. This year we celebrated this we are focusing on the access or the global challenge of access to care of quality and the inequality in the rates of survival and the results of health on the long-term basis. We have a material available in 40 languages and support from over 200 organizations on the national and international level. And you see that some organizations turn to the color of purple for that day to mark the day of the World Premature Day and support all the professionals involved in solving and helping this problem. Uh, a very important announcement for today. European Foundation for the Care of Newborn Infants. Global Foundation for the Care of Newborn Children. If the turn global, it's a transformation. The Global Foundation for the Care of Newborn Infants. This change reflects our growth as a global level type of organization, uniting researchers and caretakers and parents and children to ensure quality care for newborn and the family. By becoming global, we want to ensure that every baby everywhere has access to appropriate care to resolve newborn care health on the global level. Thank you for your attention and congratulations uh, to all the participants. I am very moved to be able to be a member of the jury, and I applaud your work. And I was very happy to read your essays, and they touched me so much. Thanks for your attention. Now, Frank has the floor to make the introduction. Thank you so much. I hope that my technology will cooperate and apologies for the issues. We will introduce Massimo Salvadori, who holds a sociology degree from 2007. Then he started his career working in West Africa and Central America. He worked with internationally on the field while focusing with the management of humanitarian programs in nutrition and protection fields. Ever since 2021, Massimo is the coordinator for the Chiesi Foundation, where he's a leader working on programs for newborn and respiratory sickness in South countries. Thank you very much. Thank you so much for the introduction. I only have 2 minutes, so I will be quick. Next slide, please. Next slide. Thank you. I am the Chiesi Foundation Coordination, which is a private Italian foundation that ever since 2010 works with uh, neonatal health, and we're focusing on the scientific research programs and the geographic focus of the sub-Saharan Africa, and especially French-speaking countries. Ever since 2014, the Nest Foundation is a model that focuses on premature babies and small and sick children and on the model to have partners, among others, hospitals, to identify needs, a definition of activity, and the model is a focus on four main pillars, namely education, spaces, data, and the advocacy. So the first pillar, we work on health system and health programs, and all of the pillars of the Chiesi Foundation put at the center family care and zero separation, as you can see in the slide. Pillars 3 and 4, importation, the importance of data collection, and also advocacy and networking. We try work with partners and institutions and the health Ministry of Health. And you can see on the picture a conference that we are organized in Cotonou, and there was 7 French-speaking countries represented. Uh, Equitable and access to resources. We focused on that very much at the Chiesi Foundation. There is also the issue of access to resources, because most of the resources are only available in English. There is also an issue of access to training and conferences, etc. Most of the funding agencies are focused on the French-speaking countries. So Chiesi Foundation is focusing on French-speaking countries of Africa to focus on the exchange, not on South-South and North-South. For exchange between partners, we uh, um, tr emphasize translation of documents and initiatives. We have a good partnership with Next 360 to have access to the newborn toolkit, and we have a series of seminars in French in Dakar. We have a partnership with ANA, and I would like to mention the fact that we support ANA on the launching of the journal of ANA, available in French and in English, and a program of grants. We have a partnership with Co-INN. We speak with on the discuss the translation of training modules only available in English currently. So we're discussing that currently. For the advocacy, we support the creation of CAPS in Senegal. Is the first country that launches a few initiatives. It's a French-speaking country of Africa, and a partnership with Amref Health Africa. And to conclude, we support the translation of various documents and resources. And last week, we were invited to participate to regional consultations to each woman, each newborn everywhere. And it was a very important event where West and Central African countries were present, and we had funding agencies present as well. Thank you, and I will stop here. So I don't know if Frank's connection is still working, but I can conclude the next slide. for our next webinar, which will take place on December 3rd, and which will focus on cartography and palliate gaps in the neonatal research, and focus on the research in for implementation and equity. There is a new research, and we invite you to join us in this webinar. Thanks. Next slide. We also have a few instructions if people want to remain for a few more minutes to participate in a discussion. We will open breakout rooms if you don't wish to remain here. Thanks for your presence today, and thank you to our participants and presenters. And we thank you so much to our donor, Nest 360. I will open up the breakout rooms. In the first room, Frank and Faust, a neonatal African Association, and going in second room, you have the French toolkit. Room 3 is newborn toolkit in English. So if you wish to join the discussion, I encourage you to participate to the discussion on this in this room, and we will close and send the link. We'll give you the newborn till kit link, and thank you everybody.